Hi, this is Dr. Jennifer Reichel at Pacific Dermatology and Cosmetic Center, and we're going to do some under eye injections with a filler called Belotero. It's a hyaluronic acid filler, really nice for under the eyes. It flows very smoothly. This is Reichel, who we're going to treat, and if you want to bring the camera in close and take a look at her under eyes.
She's so pretty.
Yeah. Okay, I'm going to go ahead and put on some gloves. And we've prepared Reichel with a topical numbing cream so that she'll be a little bit more comfortable during the procedure. And my favorite thing to use is actually a Q-tip. So here's the syringe of the Belotero, and I've got one. And here's my Q-tip. And here's the patient. Okay, so I'd like you, if you can, to keep your eyes open. All right, and here we go. We're just going to start here. Do a little injection. And we need some lidocaine. Okay. How you doing, Reichel?
Great.
Good. And then I just take the Q-tip and I roll it, and it just kind of rolls into place.
Doctor, how deep do you inject the product?
So I'm actually going all the way to bone, and then I pull back just a tiny bit because I don't want to be under what's called the periosteum. I want to be just above it. And that's what I'm doing here with Reichel. There are some patients that I'll actually be more superficial with, depending on exactly what their issues are. If they have a lot of wrinkles, then I might be more superficial. With Reichel, she mainly just has some dark circles under her eyes, sort of indentations, or what we call tear trough deformity.
Look at the improvement already.
I know, isn't that amazing?
Fast. Wow.
Okay, and you can't smile? Good girl. Yeah, so if you can see already just the comparison of this eye to this eye. And she'll have some swelling. She may get a little bit of bruising. And the swelling lasts for about 2 to 3 days. It usually starts pretty immediately.
What kind of post-procedure care would they do?
Well, icing is really important. And making sure that you don't press on the area. You don't want to, you can actually move the filler around. You don't want to do that. So just sort of taking it easy, no exercise the day of, and by tomorrow she can go back to normal activity. And there's that eye. That looks great, actually.
Yes, it does.
You're a really good patient, Reichel.
Thank you. You're a really good doctor.
Oh, you're sweet. Thank you.
Do you always only use one syringe for both eyes, or?
Almost always. It's in a rare event I may need, a syringe per eye, but that's pretty uncommon.
Is there like an antidote for the product?
You mean if you were to get a lump or a bump?
Yes.
Yes. So you can use something called hyaluronidase, Vitrase, which actually is another injection that you can actually inject in to dissolve away the product. So, but of course we're not going to get any lumps or bumps.
No. If something did happen though, how long, what kind of time frame is there where you would get that antidote?
Well, I usually tell patients to wait a couple of weeks because it could just be swelling and bruising that they're seeing rather than a true lump or a true bump. And at that point, at the 2-week mark, if they come in, you could do the hyaluronidase at any point thereafter, anywhere from then up to 2 to 3 years. And that's it. We're all done. She didn't even have much in the way of bleeding at all. Good job, Reichel.
Thank you.